Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and this is a series of lectures on your heart health. So let us begin with the main feature presentation for this video, and that is going to be on exercises to improve your heart health. And this exercise program is going to be based on the same regimen we use for cardiac rehabilitation after patients had a heart attack or heart surgery. So this is something that is recommended by the medical profession, unlike what you see on the social media, which is trying to hype certain things and make other things different. So first, the purpose of this cardiac rehabilitation is to get you back to be functional after a heart attack or a heart surgery. And if you follow the same principle, so you will be very well prepared to improve your heart health even before you need it, even when you're younger. The purpose of the cardiac rehabilitation or exercise program for heart health is to improve these collateral circulations. Collateral circulations are like detours. There's small channels. When a freeway is blocked, then you have these small, like 2-lane channels that are open to move the traffic so that there's no stagnation. Same thing happens when you get a blockage in the artery, the blood supply becomes very minimal. But in order to make sure that the heart muscle doesn't die, the blood vessels from the other regions come and develop these side channels, which keeps the blood supply going. You can follow my white arrow here, and keep this heart muscle viable. That's why when we have heart problem, we have small artery blockages, and some of those areas are not getting adequate blood supply. But by getting involved in a regular cardiac rehab exercise program, you can improve these collateral circulations, improve the function of the heart, and improve your exercise capacity. And that's why we need to stick to a regimen that is used in the hospitals and in the clinics for cardiac rehabilitation. Here's an example. You have a critical blockage of a coronary artery here, and this area which was not getting adequate supply is being channeled by these collateral branches. Like here are all these tiny branches which we normally don't see on angiograms. Now we can see because of reduced blood supply, the heart muscle sort of says, hey, I'm not getting enough oxygen, and the signals are sent to develop these collateral circulations. The same thing happens when you exercise. Interval exercises helps to improve these collateral circulations. Okay, now we have to stick a certain regimen. You just can't do any kind of exercise and expect that you're helping your heart. Actually, some of the exercises you are doing now could be hurting your heart, and I'm going to show you which ones are those which are going to be hurting your heart. Because just like skeletal muscle, like your arm muscles or thigh muscles, when you overexert them for the first time without doing any exercise before, you know how it feels. It feels sore for a week. That's exactly what happens in the heart. Because when the heart muscle is oxygen deficit over a period of time, it leads to muscle damage. It leads to pain and stiffness. Anyway, so the maximum heart rate for any person is basically 220 minus the age. Let's take, for example, you are 50 years old and you want to engage in an exercise program because you were detected to have a little mild chest pain. You went and saw a cardiologist and he said your stress test is normal, but you're a little overweight and you smoke. Man, that's not good. Okay, you got to cut smoking and you need to bring your weight down, and then you need to get on an exercise program. So I'm going to walk you through as how I would recommend an exercise program for this 50-year-old gentleman, Mr. Simmons. So Mr. Simmons, for your age, the maximum heart rate is 170. And we recommend for you to keep your heart rate between 60 and 85% of your maximum heart rate. So when you exercise, Mr. Simmons, your heart rate should be between 100 to 140. Keep that as a target, because don't jump on the treadmill and go 6 miles per an hour and try to get a heart rate to 180. You're damaging your heart, because when you exercise beyond your capacity, heart goes into oxygen deficit. When there is oxygen deficit, the cellular functions are impaired, and as a result there could be damage to your heart muscle. So stick to the guidelines set by the medical experts. So I would keep your heart rate between 102 to 140, and you exercise for 5 minutes. Take a little break. Why? You want to allow time for the muscle to catch up with the oxygen deficit. Not only your skeletal muscles that you are exercising, your legs, your arms, when you're swinging, walking, when you're walking, you're exercising your legs and arms, your heart muscle also needs to get some rest. The exercise program we generally recommend is like 25 to 30 minutes, 4 to 5 times a week. It can easily be done. It is nothing rocket science. It's not like a rocket science. You can add up just even walking from the parking lot to the grocery store. I generally spend an hour in the grocery store. You know, you may be wondering, man, what are you shopping there? I said, well, maybe I don't need to shop anything. I just want to go around, hold the cart, go around, look around all the stuff, what's going on. And since I'm a cardiologist, I recommend healthy living. I always do research and see, hey, what are the foodstuffs? What are the calories? How many grams of salt are there? And how many grams of fat there? So I just study the whole grocery store. In the process, I spend an hour. See, that's somewhere you can keep adding your exercise on a daily basis. Even if you don't do any regular programmed exercise, if you can walk for 45 minutes, the American Heart Association says that is equivalent to 25 minutes of programmed exercise. You get it? Park your car at the end of this strip and walk all the way back and forth, and you get your exercise. All right. The good thing about walking in the grocery stores is it's air conditioned. Somebody is paying. You're paying for it. I mean, you buy stuff, you're paying for it. So you might as well use it, because if it's cold outside, if it's raining outside, if it's drizzling, you don't want to be doing that and catch a cold, and that's not good. So anyway, let's get to the exercise program here. First of all, 5 minutes of warm-up exercises. Just stretch your arms, your joints. Ooh. See, you need to loosen up your major joints, shoulders, elbows, wrists, same thing with your hips, knees, ankles, and your back muscles. Don't forget. See, you got to stretch your back like this, and back. Same thing with the neck muscles. When you exercise, your body muscles are now warmed up. So when you try to jog, they're not going into spasm. The worst thing you can have is a muscle spasm, then it will just cripple you for 20, 30 minutes. So once you loosen up these joints for 5 minutes, then you take your first exercise, which is the aerobic exercise. Aerobic exercise is where you exercise in such a manner that you are able to comfortably meet the oxygen requirements of your skeletal muscles and also your heart. So you exercise for 5 minutes, and I'll tell you what kind of exercises would be useful in that situation. Then you take rest for 2 to 3 minutes. Then you repeat this process like 5 to 6 times. And then you're done with your programmed cardiac rehabilitation exercise program for that day. You can relax. Okay, the exercises that we recommend are like brisk walking. Make sure you have a very good jogging shoes, so that you minimize the impact on your joints, minimize the impact on your foot, because more people have joint injuries and foot injuries by vigorous jogging on concrete surfaces like the freeways, like during marathon. Think about it. Bicycling is a good exercise, but you don't get the same amount of aerobic exercise as when you're walking briskly. Rowing is a great exercise, but it do not exercise your hip joints and the back muscles. So that's swimming is a good one because you're moving both arms and both legs, and it is low impact. Your joints are not going to be hurt, and but you may not be able to get your heart rate up as quickly as you want to, as compared to that with brisk walking. So when you're doing brisk walking, you want to swing your arms as much as possible so that you increase the muscle activity in your joints, like the shoulder, the elbow, and the wrist, all these things, so that you get maximum exercise. Now let's talk about weightlifting. Weightlifting is also an interval type of exercise, but as a cardiologist, I'm going to give you some cautions about weightlifting as compared to some of the exercise physiologists who may say, weightlifting is good for you, weightlifting is good for you. No, I would say no, because according to the cardiac rehab program, we recommend like 5 pound to 10 pound weight lifting for the wrist for strengthening your forearm muscles. Whereas for the shoulder and all this, we recommend 25 pounds. You should not be lifting more than 50 pounds if you are talking about cardiac health, cardiac rehabilitation. We are not talking about, Mr. Muscle building here. I mean, I don't care. That's not what the purpose of this one is. You're 50 years old, you're a little overweight, and you smoke, and your blood pressure is a little bit high. The last thing we have here is for you to get on the stage and say, Mr. Muscle, here, what do you think? That's not what we're interested in. Okay, we want you to be heart healthy, so that's the main focus. We want to strengthen the muscles because when your muscles are stronger, they burn oxygen better. That means they require less oxygen to do the same work. As a result, your heart has to work lesser. See, the purpose is to improve the collateral circulation and reduce the amount of work that has to do for the same amount of exercise. This is what is known as cardiac training, endurance training. All right, here are some of the things that you need to avoid. Just think about heart as a muscle, just like your skeletal muscles. When you overdo your skeletal muscles, you know what happens. If you've never done an exercise, you just hop on the hop on the treadmill. You hop on the treadmill and start running. Next thing you know, it feels great for the first few minutes. It feels great for the first half hour. But by the time you get home, you say, oh my God. Oh, my shoulders are hurting, my hip is hurting, my joints are hurting, I can't move my body. Yes, that's because of lactic acidosis. When your muscles can't get enough oxygen, they go into deficit. That produces lactic acid because it has to break down the different system other than glucose or glycogen to supply the energy. And that lactic acid is painful. And your pain may last for several days. So you want to start slow. You want to go on a progression of slow and steady pace and reach your target and stay there. Okay, like long distance running on concrete surfaces, there are so many points against this as far as heart health is concerned. Number one, jogging on a concrete surface creates a lot of impact that is transmitted to your muscles and joints. They physically hurt your muscles and joints. Number two, if you are not trained and you go on a long distance jogging, you're going to go into oxygen deficit that leads to lactic acidosis, pain, and also strain on the heart muscle. When you push your heart beyond its target limit, it is going to go into oxygen deficit, which can damage the heart muscle cells. And again, heavy lifting is another thing that we do not recommend, because when you lift 100, 200 pounds, you are creating a lot of tension. And when you create tension, that raises your blood pressure. When the blood pressure shoots up, the heart has to pump against an extra resistance of this increased blood pressure. And that is going to strain your heart muscle. Think about it. You don't want to strain your heart muscle, you want to strengthen your heart muscle. You want to improve your collateral circulation. You want to improve your survival. You want to improve your fitness. So these are your main aims. You're not trying to be Mr. Muscle on the stage for 5 minutes. Again, vigorous exercises are counterproductive to heart health. So, ladies and gentlemen, when you do some of these vigorous exercises, I told you it increases your heart rate and blood pressure disproportionately. It increases epinephrine level. Epinephrine is not good for the heart muscle. That's what happens in patients with heart failure. They have very elevated levels of epinephrine. Epinephrine can damage the heart muscle cells and replace them with scar tissue. So you don't want to get into oxygen deficit with your skeletal muscles or with your heart muscle. So those are some of the important things to keep in mind when you get on an exercise program. Remember, the purpose of this exercise program, or the cardiac rehabilitation as we call it, we recommend for patients with heart disease, who had heart attack, who had heart surgery, is to improve the collateral circulation, is to improve your muscle flexibility, is to improve your muscle strength, is to decrease the amount of work the heart has to do the same amount of work with the muscles, is to improve your exercise tolerance, and finally to improve your long-term survival. So stick to these things and you'll be feeling a lot better. You'll be eating better food. You'll be cutting your smoking. You'll be getting your belt size down. Then you will be a brand new person. Thank you so much, and please do subscribe to our YouTube channel. I will see you in the next video. I am Dr. Nik Nikam, a cardiologist who's been in practice for more than 40 years here in the Houston area.